Hey viewers, you're watching The Savera and I'm Vidhi Joshi. Union Finance Minister Nirmala Sitharaman, while presenting the Union Budget 2026-2027 in Parliament, placed a significant emphasis on mental health, announcing the government's plan to establish a second site of the National Institute of Mental Health and Neurosciences, popularly known as NIMHANS, in North India. Termed NIMHANS 2.0, the new institute is intended to address the lack of premium mental health infrastructure in the northern region of the nation and serve as a regional hub for advanced mental health and neuroscience services. Notably, the move aims to bridge the geographical gap for individuals seeking specialized care, reaffirming the center's commitment to mental health and trauma services. In addition to NIMHANS 2, Sitharaman announced plans to upgrade the National Mental Health Institutes in Ranchi and Tezpur, further strengthening the regional mental health ecosystem.
Reaffirming our commitment to mental health and trauma care. There are no national institutes for mental health care in North India. We will therefore set up a NIMHANS 2 and also upgrade national mental health institutes in Ranchi and in Tezpur as regional apex institutions. Emergencies expose families, particularly the poor and vulnerable, to unexpected expenditure. We will strengthen and increase these capacities by 50% in district hospitals by establishing emergency and trauma care centers. Focus on Purvodaya states and northeastern regions.
Citing the findings of the recently presented Economic Survey 2026, the Finance Minister noted that mental health has emerged as a major public health challenge in India. And the survey pointed to rising cases of anxiety, depression, low self-esteem and stress related to cyberbullying, particularly among young people aged 15 to 24. It also flagged growing concerns around social media and digital addiction, especially among children and adolescents, warning that excessive screen time has been affecting academic performance, productivity, sleep and social connections. Sitharaman also focused on strengthening emergency and trauma care services across the nation, observing that medical emergencies often impose unexpected financial burdens on families, particularly the poor and vulnerable. She announced that capacities in district hospitals would be increased by 50% through the establishment of emergency and trauma care centers, ensuring more accessible and timely medical intervention. In a major relief for patients battling cancer, the Finance Minister proposed the exemption of basic customs duty on 17 cancer-related drugs and medicines. She also announced that 7 additional rare diseases would be added to the list of conditions eligible for exemption from import duty on personal import of drugs, medicines and food for special medical purposes, aiming to reduce tariffs and improve access to critical treatments. Well, Sitharaman further highlighted the government's focus on traditional medicine and global healthcare outreach. She proposed the establishment of 3 new All India Institutes of Ayurveda in order to meet growing international demand and promote high-quality Ayurvedic products. Additionally, she announced plans to upgrade Ayush pharmacies and drug testing laboratories to enhance standards and availability of skilled personnel, along with modernization of WHO Global Traditional Medicine Center in Jamnagar. Reiterating the government's commitment to fiscal federalism, the Finance Minister confirmed that the vertical share of devolution to states would be retained at 41% as per the 16th Finance Commission's recommendation, with an allocation of Rs 1.4 lakh crores for states in the 2026-2027 financial year. Well, by combining initiatives to strengthen mental health infrastructure, improve emergency care, provide relief for patients with cancer and rare diseases, and expand global outreach for traditional medicine, the Union Budget 2026 presents a comprehensive approach to healthcare, aiming to address both the emerging public health challenges and long-standing regional disparities. That's all for now. Stay tuned to The Savera for more updates. Do like, comment and subscribe to the channel.